We are a virtual reproductive and sexual health clinic that always puts patients first. From day one, we were founded and launched in 2021. We've been committed to providing safe, discreet medication abortion treatment, no in-person clinic visit necessary. And we've helped at this point more than 30,000 people get the care that they need. Today, we offer a range of reproductive and sexual healthcare services from the comfort and convenience of your phone. Our in-house clinical care team, which is composed of incredible board-certified doctors, advanced practice clinicians, nurses, and patient care advocates, are always just a text away. And we're really committed to helping our patients get the care that they know that they need, because we believe the best person to make decisions about your body is you. We are fortunate to hear every single day from our patients about how the care that they receive from Hey Jane truly saved or changed their lives. I could go well past the minute that I've got to talk about all of these examples. These are people who are parents who are focused on raising the children that they have. These are people who are college students who have big dreams for their future, and this allows them to fulfill those dreams. These are people, excuse me, who live in rural areas, can't get a pizza delivered to them, but they can get this care delivered to their door without people in their small town finding out about.
Our Swing Care virtual clinic, we are providing fibromyalgia care that doesn't exist in the United States for more than 5% of folks and women diagnosed with fibromyalgia. Fibromyalgia is a debilitating condition with many, many symptoms, including debilitating chronic pain. And we provide an evidence-based approach with type 1A evidence for behavioral therapy through our Stanza digital health app, and our comprehensive and patient-centered warm virtual clinic with specialty trained physicians and nurses with coaching opportunities for our patients. One patient, Maria, who used Stanza, went from being bedbound with debilitating symptoms to being able to go back to work and really embrace her life. And that's really what we're about at Swing Care and Swing Therapeutics, is about bringing women back to their lives and allowing them to engage back in all the things that they want to do as a person.
Analyzing mammography images correctly is the most crucial moment in early detection of the breast cancer. The physician responsible for that is the radiologist, who has to read over 800 images per day, relying only on the technology of the naked eye. And radiologists are overwhelmed, overworked, and because of that, at risk of oversight. So we assist radiologists so they could save more lives. MIC-AI provides clear tissue mammogram for women with dense breast tissue. There were a mammography examination, which was performed for a woman with dense breast tissue. And the MIC-AI system indicated a malignant finding requiring a biopsy. The radiologist also suspected that it was malignant, but the surprise was that the biopsy results came back negative. Nevertheless, because of our prediction that the lesion should be with high score for malignant, radiologists decided to take one more biopsy, but this time using MRI, and it revealed as a carcinoma. The initial biopsy didn't yield accurate results, likely due to the density of the breast tissue, or maybe it wasn't taken in the right way. So these timely interventions spared the woman from a potential advanced condition that could have progressed over the next few months, demonstrating the performance of early detection facilitating by our system. And if they didn't have a MIC-AI platform, probably they just will say for her to come after a year or even more, and the results could be very, very worse.
Aiden is a precision medicine company. Our flagship product, the birth control test, is the first and only test designed to prevent birth control side effects. We analyze a patient's medical history, hormone levels, and genetic data to create personalized recommendations that meet each individual's biology, medical needs, and personal reproductive health goals. We also offer a 25-minute virtual care visit with a licensed medical provider who's trained in delivering culturally competent contraceptive counseling that leverages the results of the birth control test. And we can also then ship the birth control prescription directly to a patient's door in under 48 hours. And more broadly, our mission is to make scientific discovery more inclusive. Birth control side effects are really variable. They range from, annoyances like acne and weight gain to life-threatening side effects like depression and anxiety. And we've been able to help people all along that spectrum. The metric I'm probably most proud of is that we have identified genetic risk for blood clot in 7.5% of our initial population, half of whom were actively taking a birth control that put them at a 30-fold risk of experiencing a blood clot. And so one of the populations that has been kind of the largest advocates of what we're doing is actually parents of teens.
We are a clinic for women between the ages of 35 and 65 to deal with all the symptoms of perimenopause and menopause. So we spent 2 years developing care pathways to deal with all of the stuff that happened to women during this age category, ranging from sleep issues to painful sex issues to hormone imbalances and joint pain and all the other stuff. And we have trained an expert staff of clinicians who are able to take care of all these symptoms, and it is all covered by insurance. So it is not a cash pay business. Instead, we're able to provide insurance covered care, which we're really proud of. Every day, what we hear is mostly that women have felt unheard. And so here's one story. My provider listened patiently as I talked through all my concerns. She was kind and compassionate and did not make me feel rushed. It was clear she really understood me and my treatment plan. I felt seen, heard, and validated. There was none of the careless disregard or gaslighting that had been present with my other doctors.
We're a medtech company whose mission is about making precision surgery simpler. Our whole philosophy is that a patient's experience of treatment is just as important as the treatment itself. And so for the vast majority of patients with breast cancer, their story starts with them being implanted with a hooked wire that looks much like a fishing hook, and they're in hospital. And this is implanted in radiology, and the surgeon then goes and palpates that hook, and they often faint in their discomfort. And we were compelled to do something different. So our company has now helped elevate the care for 8,000 women across North America, where we implant this tiny marker the size of a sesame seed, and we use a wand and proprietary tablet to provide true 3D guidance so that the surgeon can find it with precision and confidence and remove it very quickly, offering amazing cosmetic results while also taking care of the cancer. We received a letter from one of our patients. She unfortunately had a wire and had a cancer that came back, and then she had a Molly instead, and she compared the two experiences. And she wrote our whole engineering team thanking us for inventing something that revolutionized her experience because she'd have both. And that, in terms of what keeps us going and moving forward, that was incredibly profound and impactful.
Our mission is to empower both women and clinicians with convenient, effective products backed by rigorous scientific evidence to improve pelvic floor health. Our first product is called Flight, and this is a woman who became desperate when her nephew, he'd always greet her by picking her up and giving her a big squeeze. And she leaked, and it was mortifying for her. She said the only thing that saved her, it was dark, and she had dark leggings on and nobody noticed. So she started using Flight, and the next time he picked her up and squeezed her in broad daylight, she was completely dry.